You're listening to the Business of Medicine podcast created by Mirazi. We are a medical co-working space located in Upper Hill, the heartbeat of healthcare in Nairobi.
Hi there. Welcome again to the Business of Medicine. Like we always say, our purpose here is to transfer information and knowledge on what happens in the healthcare side of things. Today, I am very, very excited to introduce our guest today, called Dr. Borna. Dr. Borna is a former colleague of mine. She's a friend, or actually I should say a former colleague of ours, a friend. But more importantly, she's been in research for a very long time, close to 12 to 15 years, maybe more, and counting. And she has nuggets of wisdom in that aspect. I will let her introduce herself further. Welcome, Dr. Borna.
Thank you. I was hearing the many years of research. An adequate number of years. Yes.
Okay, you have a wealth of wisdom when it comes to research.
Yes.
Is that better? Okay. Yes. Start with your full name.
I'm Borna Nyaoke Anoke.
Okay.
Yes.
What do you do, Borna, currently?
I am currently a clinical researcher. So clinical researcher, also very wide in its definition, because I'm currently not in direct contact with clinical trial participants. I work mostly in a sponsor role in clinical trials where we identify research organizations, academia, and other research teams to be able to conduct our clinical trials on neglected tropical diseases. Yes.
Fantastic. I'm going to take you way back to what probably was your first job. Do you remember what your first job was?
Intern or after?
It was before internship. You don't remember your first job?
Which job is this?
You are a model, weren't you?
That's way back.
That's exactly where I was going.
That's truly way back.
You even forgotten that you had such a role.
Yes. I think I always say I am remembered more as a former model than the period I was actually a model.
Yeah. Once a model, always a model, man.
Apparently.
Yeah,
apparently.
I'm sure,
it was
like,
a minute, though.
back,
It was a minute, but that was like how many years ago?
Don't say.
Yeah. Oh, yes. Okay. Let's.
And Miss Med 2008?
Exactly.
Do you know I was never actually Miss Med?
Really?
That's the thing.
What?
Yes. I was
I
never.
thought I even attended that Miss Med.
I was a judge.
Oh, you were a judge?
I was a judge. Yeah.
Okay.
I was never Miss Med. I think that's the one. I think Sheila won or something. Yes.
Oh, yeah. Okay.
Yeah,
okay.
but I was never actually Miss Med. It's just that I think my face was everywhere at the same time.
Okay.
People assumed
Yeah,
I
you
was.
were.
Yes. Yeah.
Yeah, which now begs the question. Was modeling more attractive than being a doctor?
By far.
Would you have considered dropping being a doctor?
I was not even planning on joining med school.
Oh, yeah?
So I was one of the few people who actually wanted to be a doctor. Like from when I was a kid, I knew I was going to be a cardiologist. Yes.
You were one of those in the newspaper.
No, I wasn't. Yes. I just had the passion. It was inside me. Yes. So I really, really wanted to be a doctor. Then I got a growth spurt when I was in class 6 or 7. The same thing as my daughter right now. I think my current height. I achieved it when I was around 12, 13.
What?
Yes. And then at that particular time, I grew up at the coast. So I was in Nyali Primary School, and Nyali Beach Hotel had Miss Nyali contest for the schools in Nyali. It had all these activities ongoing. Then they just went around and picked, of course, all the 12 people. And I was one of them. And then we went for it and everything. We didn't progress to the next part, but that's the first time now I discovered modeling. And I loved it because it was a whole 1970s theme. So I remember working with my sister. We did like whole bell bottoms and everything, had my hair done, then walking and people clapping. I was like, this is nice. This is nice. And then immediately I went into high school. That's Limuru Girls. Form 1, they had Miss Chocks. And of course, they just looked at height and said, you're joining. Then I won.
Oh, nice.
Okay.
At Form 1. I was like, maybe this is my calling.
Okay.
So the same thing, went for Miss High School
Mhm.
at Jamhuri High.
Mhm.
Yeah, with other schools. Also won that.
Oh, nice.
Yeah, so I think it just came easily.
Miss Insider? No?
No, but I appeared in it.
Yeah.
Yes. I
Okay.
appeared. But my first, can I say, professional modeling was right after high school, where I joined Miss World Kenya.
Mhm.
Yes. And just the same way, jokingly, because after all those, you're like, I could do this.
Mhm.
Then I hadn't even turned 18,
Mhm.
because I remember I had just finished high school. I finished when I was 17. And it was that December. So I went for the auditions in Mombasa. And I passed.
Mm.
Then they're like, okay, now we need to see you in Nairobi for the finals.
Mhm.
I'm like, I don't even have an ID. I'm not sure how I will explain this to my mom, because she knew all these things you were doing there. And weird enough, she was very supportive. And I went to Nairobi, got into the finals,
Mhm.
didn't win.
Mhm.
Then my mom was like, okay, that was a good run.
Mhm.
Yes.
Let's get serious.
Let's get serious. That time I was like, okay, there's still so much I could be doing. But I think not winning the Miss Kenya was a good thing, because now it made me start thinking, okay, even after I'd won, what was next? What was I doing? Do I want to model for the rest of my life and all that? Maybe if I'd won, I wouldn't have thought about all those things. But since I didn't win, I had to think about it. Then the same year, I joined med school.
Who won Miss Kenya that year?
That was actually Miss Universe Kenya in the year 2005. And that was won by Rachel. How do I forget Rachel's second name?
I don't know, Rachel.
If she hears this, she's going to be very offended.
We'll look it up.
Yes. But she's currently in the US. She's actually a very big TV Hollywood presenter and all that. Yes. Yeah.
You guys are still in touch?
Yes, we are. That's why I'm feeling quite guilty for forgetting.
No.
Mbui.
It's okay.
Okay, we'll confirm that. Yes.
Okay. Thank you, Rachel. If it wasn't for you, we didn't have Dr. Borna.
Actually.
Yeah.
You could have gone on a completely different path.
Yes. I didn't give up though.
Oh, you kept going.
Yes. If you remember JP,
Mhm.
because we were in class with JP, was it second year or third year? I joined another one. Yes. So the 2005 one was Miss Universe Kenya. Then in 2007, I joined Miss World Kenya. So actually, one of the promoters or trainers during Miss Universe Kenya reached out and was like, what happened to you? You disappeared. We're having Miss World Kenya. Why don't you want to join and everything? I was like, I'm in med school. It's like, no, that's actually a good thing. It will give you like a higher edge and everything. So I was like, okay, things have changed, but let me go try. Tried, also reached the finals.
Oh, nice.
Yes, but between missing a lot of the training and everything, also reached the finals, but did not win. At that time, I was like, okay, I think this is a sign. This is not where you're supposed to be. So I used to do a bit of commercial modeling. Yeah, because I realized also beauty pageants are nice, but there's no money.
There's no money.
Unless you win and then you get the sponsorship and everything. But commercial modeling, so that's why I was doing a lot of all those papers and did billboards, and all that, So that was, it was a fun, Now that you've made me go through it, yes.
I can see the nostalgia on your face and in your eyes.
There's Mrs. Kenya.
It's never too late. Like
Never
I said,
too
once
late.
a model, always a model. Okay.
Yeah.
That was fun. That was fun. Yeah, sounds like it was quite a.
It was
roller coaster.
nice.
So the whole of uni, you were sorted, while us guys were still begging for pocket money.
Thoroughly.
Okay.
Yeah. I remember the first time, because all the others, we used to do all these like small photo shoots and everything. That was like 10, 15K and all that.
Yeah.
Then I did my first billboard. So we're going to sign the contract. Then I was shortchanged, but at that time I didn't know. That time it was good. So contract for 100K. That time I was like 19.
Big money.
I was like, wow.
Yeah.
Later on, I was to find out guys are getting like 500K.
Of course.
But they knew who they were dealing with. So that time it was more than enough. Yeah. So it was good. It was good money. Yeah.
Okay. Then you got into med school.
I was in med school at that
Or
time.
rather, yeah, let me put it this way.
Mm.
Switched gears to now focus
Yes.
on medicine,
Yes.
and at that time on your path to becoming a cardiologist.
Yeah. I think at that time I had started realizing quite a bit that maybe not. But I still wasn't sure what I wanted to specialize in or do. Yeah. I always knew I wanted to be a doctor, but I think why?
Yeah.
Yes.
Okay.
Yeah.
Anyway, there's that section, and then you gone to your internship, and then we met at one of the facilities where we used to work together. But what I remember at that time is that you were working there and moonlighting elsewhere. For context, yes. At the time, you were working at that private facility, and then moonlighting across the road at the university, should I say, or maybe just shed some light on that. Yes.
So when I did my internship at KNH, and at KNH now I was reintroduced to Prof. Anzala and his team, who at Kavi were conducting clinical research. So it was just interesting. It was like, what are you guys doing there? Yeah. Then finding out that they're actually conducting clinical trials on vaccines, it just seemed something we were not being exposed to. So I was quite interested in it. But then, of course, it's internship. Like, you don't have time to be thinking about everything else. So went now to Nairobi Hospital, started working. And I started thinking now about specialization and what would I do for my master's and all that. And the research came back to my mind, and I was trying to figure out what next. So I was looking at all my options, talking to people and everything. Then also, if you remember during the launch of Mirazi, I mentioned about Amakove Wala. So I remember she had been at Kavi. So I just picked up my phone. I had never talked to her before. Just called her and asked her, what were you doing there? Like, how is it? She's like, call Prof. Anzala. Go there. I was like, okay. Like, where are you right now? I think she was in one of the pharmaceutical companies. She's like, she started there. Now she's in pharma. She's still in clinical research and all that. But she would suggest I start from that bit. Because in Kavi, you have that direct contact with your patients. You actually see the patients, you review them, you administer the vaccine, you're the one who follows up on any adverse events, you're the clinical trial manager, you're the medical manager, you're the one who works with the ethics committees and regulatory committees in preparation of the protocol development. So you get the full
range.
Yes. Yeah, within the clinical research. So I call Professor Nzala. He tells me to come over. At that time, they were starting a TB study. Yes. So as they were starting, I got pregnant. Baby number 2. So I was like, hey, TB, pregnancy. Yeah. Let's give this a pause and everything. Went quiet for almost a year. Then after I gave birth, I got a call from one of the clinical trial managers. They're actually looking for a medical doctor to be part of the team. Am I still interested? That they got my contact. I was like, yes. So she introduced me to do some online good clinical practice courses and everything. She's like, after you're done, come over. Let's see if there's an opportunity for you to do some activities. I was like, that's good. I go, they tell me yes, but we are waiting for funding. I'm like, what does that mean? Yes.
Yeah.
It means you can start, but you can't get a contract yet. I was like, okay, I have 2 kids. I'm married. This is going to be a bit hard to explain. How do I stop where I'm working and start here when I'm not even sure how much you're paying me and how long I'll be here?
It's exposure.
Exactly.
Exposure.
So at that time, I was like, okay, I really want to experience this, but at the same time, I need to have my head straight. So I tried to negotiate. So I was working. That's why you remember earlier mentioning my 7 to 1s. Yes. So I was working in the morning at Nairobi Hospital. In the afternoon, I go do the clinical research on the other side.
Mhm.
Did that on and off almost 6 months.
Mhm.
Yes, before now I got a full contract.
It was only 6 months.
Yeah, it was only 6 months.
I don't know why it felt like it was longer than that.
It was much longer.
It was.
It felt much longer
Uh-huh.
because more or less those were 2 jobs I was
Mm.
doing at the same time. Yeah, because they're also expecting 100% for you. Okay, they back paid me. That
Mhm.
was good.
Oh,
Yeah,
nice.
yeah. But while it was there, it was a lot. But I enjoyed it, and at that point, I knew this was something I wanted to pursue.
A lot of people struggle with that concept for working for free. Especially, I don't know, maybe it's a generational thing also.
Yeah. Mhm.
I don't know if you can just speak to that, because it clearly was a good decision on your part, and you have no regrets having done it. But a lot of people would say, if they're not paying me, let me let it go, as opposed to just looking at this as a means to an end to that dream of theirs. Yeah.
No, that's actually quite difficult, even with a lot of the people I try to, mentor? Because sometimes you also provide them with these opportunities. Then you hear they dropped out or something. They're like, no, I've been there 3 weeks. They haven't given me a contract. I'm like, 3 weeks?
Try 6 months.
Yes. Or they're like, no, the money that they're providing is not a lot and everything. I'm like, I actually got a pay cut from my previous job into that job. And I was like, you need to be able to figure out what you want to do and how you're going to get there. Because, of course, I had already... Also, what I usually advise people, you look for your dream job. So what I do, I tell you, maybe you want to be a senior program officer, NTD department at the WHO. Go there, look at what are the requirements of that. If it needs you to have 15 years experience in conducting clinical research, you need to have some experience in health systems management, you need a master's in public health and everything. Work towards it. So, of course, let's say you're working as a medical doctor somewhere else, but you have this time to be able to do even an online public health program, yes. But you need experience. If you're able to go somewhere and do some volunteer work, even if it's within clinical research, it adds to your CV. Because as you talk about my many years, we are also counting those 6 months and everything that I was doing that. If I had indicated at that time that, no, I'm not taking this on, let me wait until you guys are ready to take me on, you have the funding available, you have the contracts and everything, it would have been like a year or 2. And at that particular time, if they were able to get everything in order, was I the best candidate?
Exactly.
Yeah.
Would you have been considered?
Would they have considered me? Because like right now, that's the work I'm doing. You provide funding to researchers. I'm going to look at your level of experience. I'm going to look at your level of education and all that. At that time, I only had my medical degree. Yeah, I had not done my master's. I did not have experience in clinical research, but I was willing. And I was willing to learn, because even the person who was teaching me was a clinical officer who had been there for almost 15 years. Not specifically, but within that clinical research space. But I was willing to learn from him and know what needed to be done, so that even by the time you're providing me with that contract, I have something to back my name with it. And I think a lot of people right now do not want to take that time, yes, or give themselves away. There is that thing of, okay, you should know your value, but there always has to be a give and take, which people are not willing to give. Yes, it's like, no, I am a medical doctor. Yes, I've spent 6 years. I have done this and done this. They should know my value. I'm like, okay, you are very valuable, but you're not the only valuable person around here. If you just start from med school, you're like 300 in your class. Yeah.
What sets you apart?
Yes, what sets you apart?
And sometimes it's those intangibles, like the commitment.
Exactly.
The things that you can't write necessarily.
If they're
on your
seeing
CV.
you come there every single day, sometimes I used to just come, sit, because I didn't even have like a laptop or anything within there or something. I just sit, then go through their SOPs, their standard operating procedures, just read through them and everything. Go through the patient's files, just trying to understand our volunteers and our participants and everything. Yeah, until somebody says, what are you doing? Okay, come, let's see this patient.
And even just adding on to that, like at that time you were working with, under Professor Omo Anzala, and again following what JP is saying about those intangibles, like Professor Anzala is a rock star when it comes to research. So understanding that you actually should be paying for that opportunity.
Exactly.
Of working with people like Professor Anzala, Professor Jaoko, and all those other people that you were working in there. The skills they were teaching you about clinical research, about reporting and recording adverse events and all that. People pay top dollar for that.
They do.
You were getting it free of
For
charge.
free.
You eventually got paid for it.
So yeah, definitely. People don't take all that into account because, of course, Prof. Anzala and Prof. Jaoko, known in terms of virology, immunology, these are people who are known as world-renowned scholars. And people don't understand they are at your reach. And they're willing to provide you with opportunities. Because even after I worked there, I remember just small things. I was asking a question. We started our HIV vaccine clinical trial. Then I was looking at the people coming in. I was like, hey, HIV vaccine. You're actually coming to get a vaccine. For vaccine trials, these are healthy participants. Like you're not sick, but you come to get a vaccine so that we can be able to look at your immune response to be able to see if the vaccine works. I was like, why? Like, why would you do that? And I remember Prof. Anzala had me ask that. And he was like, do you understand that's the job you're doing? I'm like, what do you mean job I'm doing? Yes, I'm seeing the patients. He's like, no, you're now a clinical researcher. You're asking a question. What is the study design behind your question? I'm like, I was just asking. I'm like, yeah. It's like, no, that's a clinical research question. And I actually wrote a paper about that. Yes. Started going through all the patients' files, all the patients who are coming through, was able to come up with a clinical research question or what are the volunteer motivators to actually participate in HIV vaccine clinical trials, trying to figure out if it's altruism, trying to figure out if it's financial incentive, because of course you provide transportation, lunch and all that for the volunteers, or if there was something else. Yeah. And it was a very interesting, can I say, mini research, but it ended up well. I got published in a peer-reviewed journal. Yes. The paper also even appeared in Nation newspaper because they were like, okay, we're actually conducting HIV vaccine trials and there are Kenyans who are participating in it. Yeah. And apparently they're doing it out of altruism. Because
that's what your study showed?
Yes.
I would have guessed financial.
Truly, that was what was in my head. But if you're to look at what we are providing them, we do not do, it's actually called reimbursement. We do not pay the patient. So we calculate, maybe you're coming in from Gong. You're going to use maybe like 500 shillings in terms of transport. You would have eaten lunch, maybe 500 shillings. You're given 1,000 shillings. That's it. Yeah. So why would you rather you'd go do a day's work, get 1,000, or participate in a HIV vaccine clinical trial? Things go bad.
Yeah, I was just about to say
you get a very serious adverse event, or even get HIV, and things like that, because those are part of the questions people used to ask us. Can we get HIV from this vaccine? And you're okay, but you're still here. Yeah. So it was interesting, and that's what, going back to somebody else would have told you, you do not need to do this and everything, or just do your work and everything. But the fact that he made it into a question that I was able to conduct the research on, publish on it. Kavi sponsored me. I think I went to my first conference, which was in Alberta, Canada. Nice. And I presented that paper there.
Wow.
And I remember I was very proud of myself. I was like, okay, I had a question. I went through it, collected data, analyzed the data, and was able to publish it and present it to people
in an international
conference. And it was received quite well. And I really liked that process. I felt like I made a difference because I knew it was it was a question a lot of people were asking. But the fact that I was able to proceed with it and be able to provide an answer So I was like, okay, maybe this is where I'm supposed to be.
This is where you're supposed to be.
Yes, yeah.
That's quite interesting. Just like JP, I'm shocked that it's altruism. And even me,
Yes,
I'm even shocked that you asked that question, because sometimes you're like, you are hoping that that ignorance is what will help your study go further. Like, they don't fully understand. So then you're like, because they don't fully understand, then we're able to carry out our research. But it turns out they
So
do
that's
understand.
interesting, because I also used to have that assumption before I got into clinical research. But there has been quite a lot of bad publicity in terms of the clinical trials, especially conducted in sub-Saharan Africa. So you find even the sponsor, now that I'm on the sponsor side, on that time I was on the implementations researcher side, they go an extra mile to ensure that you're not exploiting people's ignorance. Because any patient who goes, or volunteer or participant who goes through a clinical trial, the informed consent process can take up to 2 weeks.
Oh, okay.
Yes. So you have the nurse who will go through it, then you have the doctor who goes through it, then there's actually a small exam where they go question and answer, where you have to pass the exam to confirm that you understand why you are in the clinical study. Then you go home. You're not allowed to give consent the same day. Like, we actually want you to think about it. You go home, then you come back, and then now you decide. Yeah. So even when I got in, I actually thought the informed consent process was a very simple thing. Do you want to participate? We're giving you 1,000 bob. Sign here. Yeah, we give you vaccine. Exactly. Yeah. So when I learned the screening period was 2 weeks, I was like, do we need to do all that? Yes. Yeah, like, no. But you want to be sure by the time you have completed the clinical trial with this particular participant, he can never come up and say, but they never told me that I'm going to get 4 injections. Yeah. Or they never told me they're going to take 10 mLs of blood. They never told me where my sample is going. They never told me what they're using these samples for. Yeah. So they actually have a lot of information. Quite a lot. And then there's also that whole community engagement, stakeholders and everything. So when we go to participants, if we're going to a certain area, we won't come to you as Grey. We come to your area.
Okay.
We talk to the chiefs, we talk to the area places, now we have that recruitment drive, and then they're asked to come through somebody, so that you do not feel like you are an individual just participating. You have this community that is behind you in case of anything happening.
That's a smart way of doing it. Now, that whole segment at CAVI, which is Kenya AIDS Vaccine Initiative, that then therefore changed to be Institute of Clinical Research, right? For how long were you there? Because for me, it sounds like it was school.
It was, I was actually only there for 3 years.
Oh, okay.
Yes. So within this process, I also started my master's in public health, but then I also felt the need to have a bit of more technical experience in terms of what I was doing. So, of course, you're doing it operationally, but we do not have any clinical research programs, or we did not have at that particular time. And I wanted to do a master's in clinical trials. Yes. So just to understand everything a bit more. It was not being offered around. And I remember at that time, I think it was only in the UK that there was one program that was available with the London School of Tropical Hygiene. And it involved me being there for a period of, I think, 3 years. And of course, already had kids and everything. So it was not practical. So I did my public health. Then I discovered the 1-year program at Harvard Medical School on clinical trials certificate. Yes. So I was like, since I already have my degree in public health, let me add this. So I did that for 1 year, did my master's and everything. And that time there was also quite a lot of, can I say, information going around with HIV vaccine and everything. I was doing a lot of advocacy. And then DNDi reached out to me. So make sure your LinkedIn looks good. For those people who don't take their LinkedIn seriously, they actually reached out to me through LinkedIn, through a recruiter. It was like, we've seen your profile and everything and all that. And we feel that That was the year, the top 40 under 40.
Oh.
This was in 2017.
Okay.
Yes. So they reached out, they're like, oh, we see you won this award. And it was because of the HIV vaccine work that I was doing.
Mm-hmm.
We saw this award. We've seen you have clinical trials experience. If you look at it practically, it was only 3 years.
Mm-hmm.
But apart from experience, which was the hands-on experience, now I was certified in clinical trials from Harvard.
Yeah.
Yes. So even by the time they were calling me for that position, I was like, you're feeling like imposter a bit.
Imposter.
Yes.
Yeah.
Because I went to the offices, saw the people, saw the work that they were doing. I was like, on paper, I look good, but am I setting myself up for failure? Yeah. So it was an interesting transition. Yeah, but it worked out in the end. Yeah.
Okay. Good. You've even primed us.
Yeah.
Now tell us what is first of all, what does DNDI stand for? What is DNDI?
So DNDI stands for Drugs for Neglected Diseases Initiative. So it's a research and development organization that works on neglected tropical diseases. Wide spectrum from mycetoma, which I had, to visceral and cutaneous leishmaniasis, human African trypanosomiasis, dengue, all those things we learned in school that we thought we would never see again. Yes, we found them again.
Okay.
Yes. So we are based in, our headquarters is in Geneva, but we have 8 regional offices. So we are everywhere, from New York, Rio, Kinshasa, here in Nairobi, Cape Town, we're in Malaysia, India, and Japan. So we do not conduct the clinical trials. We're able to gather funding from across the world and identify implementing partners. So this can either be academia, it can be clinical research organizations, it can be smaller institutes that conduct research. But it has to be specifically on neglected tropical diseases and has to be according to our strategic plan.
Okay.
When you say gather funding, I always find that thing so abstract. Okay, that there are people out there who have money to fund these kind of things.
Yes.
Just shed some light on that. Like, who are these guys? Who are these institutions?
I was just so surprised. By the way. Like, you're just seated there
who
and
are
you're
looking
thinking,
at neglected
I should give money
diseases,
to Sudan.
tropical diseases. Let me give them $50 million. Like,
so NTDs, unfortunately, is among those diseases that actually receive the least. But there are people who provide funding. So, of course, things like HIV, malaria, tuberculosis are the ones who receive the most funding. So the different levels of funders or donors. So our biggest funders are actually governments.
Okay.
Yes. So like from DNDI, we receive a lot of funding from the Swiss government, BMZ, which is the German government, Japan, GHIT, through the Japanese government. So within their national budgets, they actually have spending for research and development. So they have some money that is allocated specifically for research and development. So that is where our funding comes from these governmental facilities. So what they do, they ensure that whatever you're working on, one way or relates to their funding priorities within the country. So in Japan, for them to provide you funding, you have to be in collaboration with a Japanese partner. So within my program for mycetoma, the investigational product that we're looking at for the treatment of mycetoma, called fosravuconazole, was discovered and is manufactured by a Japanese pharmaceutical called Eisai. So we were able to now have this grant that we were applied through to GHIT, which is also a governmental funding. And with that, we were able to get the funding that we were to provide now to the Mycetoma Research Center in Sudan, who now conducted the clinical trial. The same thing for Germany, the same thing for the UK with the UK aid, the same thing for France and a lot of the European countries, and even USAID, which we saw.
Okay.
Yeah. So the countries have, specifically for R&D, they have their priorities, and they say in this particular year, for the period of maybe 2025 to 2028, we are allocating maybe 3 billion euros specifically to R&D. Then, of course, according to what they deem as important for them, they can say 1.5 billion is into non-communicable diseases, 5 million is for neglected tropical diseases, 5 million is for pandemic preparedness. So as you plan your activities, you need to be able to be aware of that. Another group is all the foundations which are set up, philanthropic foundations. Things like Bill and Melinda Gates Foundation, which is now Gates Foundation. Who's this former president that his name skips my mind? Clinton. Yes, Clinton Foundation. And we have similar foundations who have money that they are able to actually prioritize for different activities. And sometimes R&D falls among some of those activities. So for us, we're looking at it in terms of specifically research and development. But if you look at people who are even in WASH, people who are looking at food, health systems, you find a particular foundation has specific money for that. So it's for you to identify which foundation wants to give. You just don't go to a random foundation. I go see JP Foundation and I'm working on mycetoma. JP doesn't care about mycetoma. Him, because he has a passion, came from maybe a drought-resistant area, wants to look at specifically in terms of food systems, and you're going with your proposal for mycetoma. Yeah. So you need to be able to identify. Then we have a third group, which are private funders. People who maybe they're getting tax breaks, or they just from the good part of their hearts decide they are providing this specific amount of funding. So we have a whole fundraising, business development departments whose work is to be able to identify these different categories of funders, what they are willing to provide funding on, and see how best to apply for those funding opportunities. So we make it easier for the implementing partners because, as I mentioned, we have our offices in Tokyo, in New York, in Geneva. I can say people from these high-income countries. That's why you find even for entrepreneurs, it's a bit easier for people from the global north to be able to, they know where to get the money from. I realize from the south, we tend to not know who is providing the money and where to get the money from. So like this mycetoma research center based in Sudan has been doing wonderful work on mycetoma patients for the last 30 years, but they're relying on their own resources, which definitely means you cannot go far. So when you're able to tell them that, okay, we want to be able to find whether or not fosravuconazole works, are you able to conduct this clinical trial? We'll provide you with the training, we'll provide you with the laboratory equipment, we're providing you with everything. Just conduct it, but it's also helping you in capacity strengthening. You can apply for future clinical trial proposals because now you have experience in conducting clinical trials. Yeah.
Okay.
Yeah.
It sounds quite intense. And I think you have answered that question quite exhaustively. From what I understand, then DNDI is like a conduit between the guys with the money and the guys with the research.
Yes.
But you don't have the money and you don't run the research.
Exactly.
Fantastic. Now,
we're thorough middlemen.
That's what I figured. How do you decide that this is a neglected tropical disease? You know, Loa, Chereria, Crofty, and which one? Those are the ones. Yes. Like, how do you decide this is a neglected disease? Like, if I have my research on Loa, for example.
I've not had Loa in like 20 years.
I know. Uchereria Bancroft, yes.
Yes.
I know. If I'm that guy from Vihiga, okay, I know it's not in Vihiga, but hypothetically speaking, the Lakeside region, and I'm like, in my village, maybe there are 20 people only who are suffering from it, but they are suffering.
Yes.
What criteria do I need to meet so that the NDI can now be like, okay, maybe Gray, we will consider getting you funding?
So unfortunately, neglected tropical diseases are many, very, very many. But we need to be able to balance how neglected it is the number of people it affects, the prevalence rate, and whether or not working in R&D in that particular sector is actually going to provide a good, I don't want to call return, but in terms of making an impact.
Impact, yeah.
Yes. Because if I am going to a pharmaceutical company, like what we did, Narrates for sleeping sickness in the DRC, R&D clinical trials can take almost 5 to 15 years. That's a lot of investment. So you're spending millions and millions of euros, which we need to be able to find from somewhere. The pharmaceutical company comes in terms of, we tell you are not investing in the clinical trial conduct. So we are removing that financial aspect from it. But we need the drug from you. So you give us the drug for free. Okay, you're going to use our drug for free for the next 5 to 10 years. What happens next? For a pharma company, they need to have a return. It's me telling you that right now we have over 600 million people who are affected by sleeping sickness. These are from very poor, vulnerable populations. They might not be able to afford the treatment. But if we find that it works, we are able to add it to the national essential medicine list. We are able to go to the WHO and have it pre-qualified, making it accessible to quite a number of countries. And with that, it's easier for the countries or the nations, the WHO, Gavi, all these institutions that are able to buy vaccines and drugs for countries to procure it from you. So first, we have to talk about the greater good that you're able to work on these vulnerable populations, but being able to tell them that we're not working on the clinical trial. So maybe that's another thing that I need to mention. We don't work on clinical trial itself only. So we work from the preclinical, which is the discovery stage, where we work also in collaboration with universities and other research organizations to be able to discover new molecules, to work on these mammalian models, get the drug, work on the clinical trial with the implementing partner. Then we go into access and registration. So like what we're doing right now with fosravuconazole in Sudan, we found that it works. Now that it works, we're working on registration in Sudan.
Oh, okay.
Apart from registration in Sudan, we understand that the problem is not in Sudan alone. So we are conducting epidemiological studies to understand the burden of disease in Ethiopia, in Kenya, in Senegal, in India. Then we go back to Eisai Pharmaceuticals and tell them, works in Sudan. You get a bigger market if we go to the other countries. So what we're doing right now is having discussions with the World Health Organization, with their policy departments, with the NTD departments, trying to see how we can have fosravuconazole pre-qualified. Once it's WHO pre-qualified, then it's added into the WHO guidelines. Then we can have it added to the essential medicines list. Once it is now in that holy grail, it becomes now easier in terms of purchasing, finding funds to be able to look at it. So if you come to me, going back to your question, with Loa Loa, and you are 20 in Vihiga, yes, and I'm conducting a clinical trial for 5 to 10 years, where I'm going to spend almost 10 million euros. Then I go back to the pharmaceutical company and tell them we have 20 people. Unfortunately, it won't fly. Yes. So right now, what we are relying on is on the WHO neglected tropical disease list.
Okay.
So they have an NTD list. I think right now there are 21 diseases, including NOMA that was recently added, where through the ministries of health and some of the national programs, they've identified the NTDs within countries that I can say have the highest prevalence and have the highest impact on life. So when I was talking about in terms of the diseases, like in DNDi, something like visceral leishmaniasis, in terms of numbers, it affects the highest numbers. Dengue affects the highest numbers. Mycetoma might not have the numbers, but the impact. Yes, because since you have this fungal, especially the fungal one, because the bacterial one tends to heal after treatment. You're having the bone involvements. These are patients who, without treatment, are having amputations or quality of life. So you have this cycle of poverty. So this is something you are able to pass a message where they understand we might not have millions of patients who are affected, But even if it's 1,000, you are killing off a village who are not able to be productive within the community, who do not have this financial capacity to provide to the larger economy. So they see the reasoning behind it. Yeah.
So it's not simply numbers.
It's not simply numbers.
It's
impact.
impact.
Impact and all that.
Things like poverty, being able to lift people out of poverty.
Yes.
Good. You've already told us how you landed at DNDI, because I wanted to ask how you end up at DNDI. For some of our viewers would want to get to where you are. But now in DNDI itself, you've gone through the ranks. Yeah. This lady. Please tell us now, what do you actually do now at DNDI? I know you guys, like you said, you do quite a number, or you address quite a number of diseases. But what do you specifically do?
Okay. So when I went into DNDI, now it's been 7 years. Wow. Yeah. I started as a project manager, then as a project and medical manager. At that time, I was doing a lot. I was in almost every single thing. I was in mycetoma. I worked a bit in visceral leishmaniasis. We had some work in pediatric HIV. When there was COVID, we did the COVID clinical trial, and also we had an antimicrobial resistance program. So now it's a separate legal entity called Global Antibiotic Research and Development Program. But at that time, it was being incubated by DNDI. So we were conducting clinical trials on neonatal sepsis, sexually transmitted infections such as gonorrhea, multi-drug resistant gonorrhea. We were in Homa Bay, in Kilifi with Kemri and all that, yeah. So in 2023, now I got specifically now into mycetoma. Now I'm the head of the mycetoma global program. So how DNDI works, we are divided into the diseases because R&D is our mandate. So we have heads of diseases, and as head of the mycetoma program, I am in charge of the whole strategic plan of mycetoma. That is why I'm mentioning from preclinical. We are working with universities such as Erasmus, University of Antwerp in Belgium, where we're trying to discover new molecules for the treatment of mycetoma. As I mentioned, we already have the fosravuconazole, but it involves 12 months of treatment. Okay. We need to shorten that treatment, yes. We are also working on mammalian models. We used to use these Gallerian models for our in vitro and in vivo activities. Now we need to be able to look at how it works on the mammals before we plan our clinical trials. We are conducting the epidemiology activities within the different countries, trying to understand the burden of disease. So we are working closely with the US CDC on a global mycetoma surveillance program where we are in over 15 countries to understand this disease. Access and also regulatory in terms of registration of the drug, working closely also with the WHO in terms of WHO pre-qualification, and then working access, talking with the ministries of health in the different countries that we're in to be able to provide information on what is needed. Yeah. So in short, everything.
Yeah, that's quite a bit.
Yeah.
Quite a bit. Okay. It looks like you guys are doing some really, really good work.
And then, you, ever since I've known you, you've always been very, very calm. You rarely ever look flustered. And you've done a lot of all these things and still had a family and all these kind of things. What did that balance look like? Because it looks like you've achieved a lot in a very short space of time and really quickly with razor focus. It can't be easy balancing the two, or was it a breeze?
Who says I've balanced?
I don't know. That's what I'm asking. You look from the outside.
No, but I actually have is it a meme or a photo of that? I always keep it. It's of a duck. You know the way the duck looks very nice on top, gliding. But if you look under what is, yes, that is my life. Yeah. So I think is it a good thing or a bad thing? But I got it from my mom. She has that thing. Yeah. You know, those people who are involved in hundreds of things, but it is, you cannot look like what you are going through. Yes.
Don't look like your problems.
Do not look like your problems. Yes, your problems are for you, because actually no one cares about your problems.
Yeah.
They really don't. Yes. So your problems are for you. So you just continue flapping inside there on top. You're okay. Yeah. Balance, I always say there's no balance. Yeah. I think you have to choose what you need to do. You will drop some balls, expect to drop some balls, and you need to be okay with it. There are times I have decided, like when I was doing my master's, I was doing the clinical trial certificate. I started my master's, I think 3 months after I had just given birth. And I started the clinical trial certificate, I think 1.5 years after my master's. So I was doing everything at the same time. Had 2 kids under the age of 5. Doing my master's, I was doing this. I was also working, and yeah, at that time it was a lot. Yeah. And of course I'm married, and you're supposed to be a wife. So I knew I was dropping quite a number of balls, but I knew where I wanted to be career-wise at that particular time. So I was like, sorry. Yes. Like right now, I'm not going to be the mother that I wanted to be. Yes, because nannies are going to take a huge part of your life. My husband, I was like, I know you would have loved a wife who can cook for you or you find at dinner, but you will have to order in. Yes. Or my friends and family, and are like, I know I haven't seen you for a while, and we are not going to see each other for a while, but yeah, this needs to happen. And I think it paid off in the end, because right now things are still quite a lot, but I am able to, at this particular time, plan my timing a bit more, as I was mentioning to you before. Yeah. So the travel is a lot, the work is a lot, but I think at the phase of my career I am right now, I'm a bit more in control in terms of determining when to travel, what to do, unless it is being set by our donors. Then that one you have to run. Yeah. But in the others, yeah. But still, even at this particular time, because you'll hear you're supposed to be in Japan for like 2 weeks. Yeah. I remember I missed my daughter's mother-daughter tea something. Yeah. And she was not very happy with me. And I was like, we're not making it. I will try to make it up. Yeah. It's not the same. Yeah, but it's not happening. And I feel sometimes they also need to learn disappointment. Not everything is going to happen. Yeah. And then also for me, I had a very career-driven mother. She's also a doctor, a PhD. And I did understand that she's doing her best. Her best, though, has to be balanced along everything. Yes. My best is, I have not seen my husband for 3 weeks. We are going away for the weekend. I won't see you. So you're telling your kids, you stay home for a bit, or they need me in Sudan. I'm not picking your calls over this weekend. Yeah. Okay. Unless someone has died. Yeah. You can call me then. But if not, yes. At the same time, when I'm at work, is being able to understand with the drivers, the nanny, everybody knows what they need to do. Like, I don't need to call at 7 a.m. to know if the kids have been dropped off at school. I don't need to be called at 6 p.m. being told there are no tomatoes at home. Before. So for me to work, everybody around me needs to work. Yes. Yeah. And that has been difficult to get to. Sometimes it still doesn't happen, but yeah. Yeah. Because of course, as you grow up, you imagine yourself, I'll be that mother who's in the PTA, I'll be doing this and everything. I just realized my kids have a parents WhatsApp group. My daughter's been in that school for, I think, 10, 11 years. I found out last year. I was asking about something from our parent. Then she's like, but we put it in the WhatsApp.
Posted it on the group.
what's up for for the parents one? It's like, yeah, for year 8. We've been moving from year 1. I was like, 8 years. Like, it just, okay.
Did you join the WhatsApp?
I finally joined. Then I realized why I'd never joined before. I was like, okay, this is a lot. Mute. Yeah.
Okay.
So, yeah, we are always striving for it. There's this lady I love, Indra Gandhi, apart from my mom. She used to be at Pepsi, CEO. Yeah. So I usually listen to her a lot. Especially for women, I think there's a lot of pressure for you to be perfect in everything. Like, you have to be a good wife. You have to be a good mother. You have to, at work, be a good employee and everything. Those ones of, if you do something, women are emotional. So you try not to be emotional. And at that time, everything is crashing around you. So the pressure is everywhere. So especially for the young females I usually talk to, sometimes it's for you to decide that the pressure won't get to you. Yes. It's like, I'm a good person. Yes, I will get to the good wife at one point. I will get to the good mother at one point. I'm not a good employee today, but next week we'll do better. Yeah.
So I'm going to ask this in a bit of a very Kienyeji way. All right. So I'm a doctor. Call it a medical officer or even a consultant in a public institution. And I have this great idea for research. I need it funded. And there's a grant I want to apply for. But I also need that money to trickle down into my pocket. What does that look like? How does it work? Is it possible? Because I hear there are all these things for, I don't know who is the most senior person in the institution, needs to be, just demystify that whole thing for me.
So unfortunately, that also occurs quite a bit. So you have to be very strategic in how you're looking at it. First of all, do you have grant writing skills? People assume grants are just there. I will see a grant, I will write. There are actually skills associated with grant writing. You hear there are people called grant writers. Yes. And this is because, as I mentioned, if you have a donor, this donor or funder, they are very specific in how they want their money to be utilized. I want my money to be utilized for climate change. You are telling me that if you conduct skin analysis for 500 patients, you're able to prevent them from getting melanoma. It sounds good because it's associated with the sun and you're thinking climate, but it's not what the funder wants. So your idea is good. It's preventing cancer. You're saying it has a huge impact. But if you're not able to meet the requirements of the funder, you will not get the grant. So grant writing skills are very important, and there are usually even some online courses that allow you to be able to get the skills, which allows you to understand the objectives of whatever grant is out there, who they need it to be implemented, because it's also indicated. As a funder, depending on how big the organization is, if you have like the Gates Foundation, a governmental facility, they have a team of people who do monitoring and evaluation, who are able to do auditing of the company or the teams. So with them, it's easy for them to provide 10,000 euros to an individual, because they have mechanisms to be able to follow up to ensure you use the 10,000 properly. Then you find others who maybe they just have this amount for CSR that they want to utilize, but then they do not have the capacity to come and follow up with you and see that you actually enrolled those patients, that you actually bought that machine. So what is easier for them, they will go to University of Nairobi, which is an established institution, which has its own mechanisms for auditing and quality control, and say, we will give the money to UON, and I expect from you these financial reports. I expect quality control. I expect an auditing to be done on your end. I just want the reports. Yes. So it's to identify who is the right person for you. Going as JP to an institution that does not have the capacity to follow you as JP is not going to give you the money to you directly. And you'll be thinking, oh, it's because I'm a small fish and everything. But it's also from their perspective. I am not able to follow up with you to understand how the money is being utilized. And when they're giving this money, they want a change to happen. They need to understand where the money is going. So it's you to understand who is giving the money and how they want the money utilized and how they are set up. There are very many organizations that give small grants to individuals. How can you be able to get that money? It's very easy. I have an idea in terms of I am implementing an activity maybe in Meru, where I am going to review a number of patients. I am looking at data records, or I want to conduct a research activity. I need to be there for 6 months. That 6 months that I am spending there, I will not be able to work. I need to pay rent. I need to pay for my food. I have a family that I need to take care of. There are donors who understand that. And they understand that for you to spend 6 months in this particular area to conduct these activities, I need at least 2,000 to 3,000 USD or euros to take care of myself as I conduct this research. And they will provide you with that money. Yes. So it's not that you say, I am going to develop a vaccine for tuberculosis. And then I decide I'm going to ask for 2 million euros and I give myself 1.5 million euros and expect to conduct research with the 500,000. Yes. You're just building yourself up for failure. So you need to understand at what capacity you need it as an individual level and at what capacity you need it to be able to implement the activity you need to implement.
Okay. And then let's talk salary scales. Because a lot of people in our comments will be like, no, this research thing, iko na pesa. So the guys just starting out or looking to get into it, like what does the money look like from, like, say, an intern, a project manager? Is it worth them coming out of clinical?
Kuna pesa na hakuna pesa. So it depends, of course, as you mentioned, at what stage you're in and where you're at. Because as I mentioned, going now into Kavi at that particular time, getting a pay cut is because, first of all, in Nairobi Hospital, I am a medical doctor who's post-internship and everything. But going into Kavi, I do not have experience in clinical trials. I do not have this tertiary education. I don't have masters. I do not have a PhD, because clinical research, they have a huge reliance on making sure you have that technical background. So they want a master's, they want a PhD to be associated with the work that you're doing. So you just don't go there with your undergraduate. So if you go at that particular instance, if you're to go to Cambridge right now, you have to go to KVICR or to any other institution where you're working as a project manager, you might earn almost 70,000 to maybe a maximum of like 120,000. Okay, that's over 12 years ago. Yes. So I am not quite sure of the pricing right now. So at that particular time, and I remember for us doctors, we were being, I know right now things have changed quite a bit. They were increasing money for us. Yes. So it was, okay, we're getting increased on this side. Here you're going for less. Why? And everything. So, but as you grow, it becomes easier. For a principal investigator, you can easily command between 5,000 to 6,000 euros per month just for you to oversee a project. And most principal investigators do not oversee one project. You have like 3, 4, 5, 6 occurring at the same time because you have different people working under you. So if you calculate that, you can have almost 24,000 coming in for project oversight specifically. Then that is from the implementing aspect. Then now if you go to my area, which is now more of the donor side, more of the sponsor side, the good thing with this side, it is more of international guidelines because you find for most of our organizations, especially for the NGOs or the pharmaceuticals, they're not African-based. They're international-based. And with that, you are able to negotiate your salary with international standards. So you find that a project manager can earn between 300,000 to 500,000 Kenya shillings. Yes. And as you go higher, it becomes almost 500 to almost 700,000 in terms of senior project manager or clinical trial manager. CRA is also the same thing. That's the clinical research associates. Then as you go more into head and director roles, then you can even get 7 figures. And this is because if you also look at it in terms of the international standards, from senior project manager going into heads and everything, they all earn over 10,000 euros and above. So you're able to negotiate the same. So if you're able to get GSK, Novartis, Bayer, get a good international NGO, and you're able to build yourself up quite quickly and have a good, what can I say? Good backing in terms of the technical experience and everything. It's very easy to get 7 figures and above. Yeah. So there is money, but it may take time.
Okay.
Yes.
That's the thing. The part where the time you've been in school for 5 years, nowadays they do 6 years for undergraduate.
Yeah.
Then after that you go for your postgraduate and for research it's about 3 years. Then you add your other certificates on top of that. And then on top of that you have to add the experience. I think that's the part that people easily overlook.
Patience, perseverance, because that's the same thing. Because even with some of the activities that we conduct or these small research activities, you get somebody, she or he is 1 or 2 years post-med, then you offer them a clinical research associate job or a clinical trial assistant, then they're like, I can only take 500K. What are we basing this on? But I'm a medical doctor. Yes, I know my worth. Like, okay. And you're going to go back to the county and earn 80K. You have to be serious because you had other people are earning 500K. You said, because also that experience works a lot, because you might come in, say medical doctor, 500K. You get into an NGO like ours, you find a clinical officer by training is earning double your salary. Yes. And also that's another thing I think with doctors, and also I think in general, we do not, tech space, I find it a bit different. They talk a lot about what they earn, what they expect. We do not. I remember when I was leaving Kavi and I was recruited at DNDI, I asked for, I think I added like 100,000 to my current salary at then. And they took me, they're like, no, it's okay. Yeah, that's fine. They did not argue. When I saw my contract, they had doubled my request. I was like, hey, I am that important. Like, they see my worth. I realized.
Yeah. You don't know your worth.
Yes. Because the scale I was coming in, it's an international organization. They cannot give you below what you have come in. They actually gave me the minimum of the scale I was supposed to be in. Yeah. But I did not know. And the people I was asking were not telling me like what is supposed to be there. So once I found out the scale, I was like, okay, Kumbe, you started me down there. And there's space for growth. So I'm usually quite open even for people who come in. And when you tell me like your experience, your what and everything, and you're coming in for this particular role, I'm like, that one, minimum, ask for 350K. You've been from the Ministry of Health, you're coming in, you are working as a senior CPM and everything, not less than 650K. Yes. And it's easier once they come in, because even for the HR, they're like, okay, you understand the skills and everything. Even if you look online, by the way, you find all these international organizations, they give you the skills. So you're able to understand what they do. Yeah. Which I think is very important. So you get to know your worth. Yeah. A bit faster.
Fantastic. Now, as if what you do is not enough, there's this other little baby I know you have called Zuri Health. Tell us about Zuri Health and what role you play there.
Okay. So Zuri is my actual baby. That's our firstborn. She's called Zuri. So the good thing, beautiful, good, translated quite well to good health. So this is founded and also operated. The CEO is my husband, Nyaoke Anoke. And this was started in 2021. And the discussion started in 2020, where we were talking about, with COVID ongoing, telemedicine, the discussions started. A lot of things were being done online. He had a health scare that particular time. And I remember also with my pregnancies, had quite a lot of difficulties. So trying to figure out a way in which we could ensure that there's access to healthcare. And then, of course, working within this entity space with a lot of vulnerable populations is understanding that the healthcare is important. The doctors are there. The people who need this healthcare are not accessing it. What can we do about it? He's in tech. So for him, it was very easy. You have the doctors here, you have the patients here. It's just to connect you to. How do I connect you to and everything? And interestingly, that is how Zuri Health was born. So I do not have an active per se role within Zuri Health in the advisory board, where we are able, and a director of the company, where we are able to provide medical, as I mentioned, is in tech, the medical aspect of the organization in terms of healthcare and also now research.
Okay.
Yeah.
And going to open another can of worms. Now, you mentioned telemedicine. And what is your feeling in terms of the uptake of telemedicine in our current local setup? What has your experience been, and what do you think the future holds?
I think it's been very hard. First of all, people not understanding what it is, and people not just being the consumers or the clients, even regulatory. You know, we do not have regulatory mechanisms to be able to even register Zuri Health in terms of a telemedicine company, because they're used to a brick and mortar hospital where you're able to provide healthcare facilities. So that has been quite difficult, but I'm seeing there's quite a lot of change with the digital health and all that is coming on for telehealth. And with all the other companies also coming up, it's making it a bit easier to navigate these ways. Then another thing is also how we have been, how we understand health. You know, those ones they say sometimes you just need to go to the doctor, they touch you. You feel, you feel better. Or how they used to say you inject somebody with distilled water, and then just because they got an injection. So there's still that mentality around health. Like I have to go if they do not remove the stethoscope, because you'll hear people complain, nilienda kwa daktari hata kunishika, aliniangalia tu, he didn't do it. Yes, So now talking to somebody over video or on call or texting, because we even offer SMS services, is letting people understand that you're still able to get that same level of service that will allow you to get better. So it's still a long way off. The same thing with technology as a whole. It takes quite a bit of time for people to understand how it works and how it can impact them. But since now we have regulatory, we have ethics coming in, we have all these companies coming in, more and more people have access to telephone, to internet. We're hoping that telemedicine in the future would be the go-to healthcare service.
Thank you, Dr. Borna.
Thank you so much. I'm always so impressed when I sit across people I went to school with, the class of 2010. Shout out class of 2010. And this is actually the second time you've indulged us as Mirazi. The first time was at Get Out. What was actually our launch event.
I'm saying too many Get Outs.
And actually, that event is what led to this podcast. So it's kind of full circle. So thank you so much.
Asante.
You're doing great things, and I wish you all the best.
Thank you so
in
much.
the future. Yeah. All right, guys. That was the business of medicine. Thank you so much for watching this particular episode. Like we always say, we are here to tell the stories and preserve some of the stories, the great healthcare stories of people, of businesses. and researchers such as Dr. Borna here, so that you guys can have a bit more information of what actually does happen in this industry, so that it's not siloed and that we're just transparent and people know what's going on. So thank you, and we hope to see you on our next episode with our next guest.